someone would be saying that we're 2 states out of 50 to be ahead of the pack. And not only ahead of the pack, but ahead of the pack is something that for the next 20 or 50 years could have foreseeable benefits and everything from better health care, meaning better society meaning better employees meaning a better economy, et cetera, et cetera, et cetera. My question relates to something that you were talking about earlier on the other alternatives. And I was just curious, before we ever get to the alternatives, this is kind of backpedaling a little bit, could you name the 7 states that have successfully launched the exchange and launching the exchange in their states?
I can't. You're going to test me, but I can do this.
Well, the reason I just asked, you mentioned that, but the reason I'm asking questions of you and of our hospitals and others is that there's nothing more important, in my opinion, as we sit here as lawmakers than to take something like this and remain contrite and proactive on sustaining our leadership model. I mean, this could be something that could benefit the entire country, and we should be standing on that like Silicon Valley stands on Google. So I think we've got a great opportunity, and I just want us to stay ahead of it. But those 7 states would be helpful for us to just know.
Absolutely. And by the way, so I am, by way of background, from Alabama. So I feel your pain of always being last. We are always in the bottom 2 in my home state. I can tell you also that I am full disclosure, I came out of the Heritage Foundation. I was a visiting fellow there. I have worked for 2 different Republican governors and a former Secretary of Health and Human Services under the Bush administration. And we talk about how this will improve health. We talk about this as an insurance issue. But the reality is, this is an economic development issue. For every state, particularly on the small group side, this is an economic development issue, and I think we need to view it as that. Those 7 states are, I'll even try and give them to you alphabetically. California.
Be glad I'm not making you spell them.
That I can do. California, Colorado, Kentucky. I already messed up. One is Connecticut, New York, Rhode Island, and Washington State. Was that 7?
Yep. And that is from a standpoint of the technology. I mean, again, cover sort of what your classification is.
So the criteria were, and I'll give you a few of them here. No federal investigation, because that actually ruled out several. They had to have been ready for launch. That also ruled out several. They had to have launched on time. They had no reported security breaches. They were not facing any kind of lawsuits. That again ruled out several. And then we also said they had to have enrolled at least 25% of their target population. And that really whittled that list down. So we actually are doing some site visits. We were in Kentucky a few weeks ago. Members of our team went to California last week. I am working with the state of Colorado to arrange a site visit there so that we can see a system demo and actually ask, when you talk to vendors will tell you almost anything they want you to know. We are actually going to the purchasers, the buyers, the folks who are in the same situation we're in, and we're saying, how did this work for you? What would you have done differently? And every state we go to, we actually ask for a session where it's just us and the state, no vendors allowed, a closed-door session, so that we can ask those hard questions. And they have actually been very forthcoming with us.